I love surgery because it gives you immediate gratification. You can immediately impact somebody's life for the better, which is why, like, I never went into, say, internal medicine. I couldn't see myself treating somebody's blood pressure for 30 years, you know?
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. Now I have Dr. Babak Dadvand from Dr. Dadvand Plastic Surgery. Dr. Dadvand is a double board certified plastic surgeon in Beverly Hills. He obtained his undergraduate degrees at the University of Pennsylvania, where he double majored in fine arts and chemistry. He completed medical school at the University of Pittsburgh and a surgical residency at the prestigious Cleveland Clinic. He completed his plastic surgery fellowship at Indian University Medical Center. He has been a plastic surgeon in Beverly Hills for 17 years, where he combines his 12 years of medical training, fine arts background, and years of experience to provide his patients with exceptional results. He's also performed a variety of cosmetic surgeries, but specializes in gynecomastia surgery, transgender chest and body masculinization, and high-definition vaser liposuction. So welcome, Dr. Dadvand. Glad to have you here.
Glad to be here.
Great. So let's just dive right into it. So tell us, how did you get interested in aesthetics in medicine in the first place?
So, when I was in undergraduate, I always knew, even though I was a fine arts major, I knew I wanted to pursue medicine. And when I got into residency, I actually wanted to be a vascular surgeon, interestingly enough. And so through the general surgery residency, we rotate on all these different specialties like vascular and cancer. And one of the rotations was plastic surgery. And it was a 1-month plastic surgery training in my second or third year of residency, but it was on the reconstructive side, so no cosmetic. And it was, for me, really eye-opening. For the first time, I'm seeing not just surgeons as like mechanics, but really thinking outside the box to kind of come up with creative problems to fix people, right? So for instance, like if you've got an appendicitis, there's not really a creative way to get your appendix out. You just go in and take it out, right? But if you have a woman who had a mastectomy for breast cancer, there's a lot of creativity and thought that has to go into how do you reconstruct her breast to make her feel whole again, make her feel feminine, and make her basically feel like she was before surgery. And so in a kind of interesting way, like my fine arts kind of training indirectly kind of fueled my desire to then pursue plastic surgery, because it was like the perfect combination of art and science, technical things that I love as a surgeon, but kind of thinking outside the box and being creative and using the eye that I kind of honed in my fine arts training.
Got it. Now, could you discuss some of the more popular treatments that your patients come to you for, and also why do you think that they're so popular?
Yeah, so the first few years of my practice, I pretty much did everything, tummy tucks, breast implants, liposuction. And then probably about 12, 13 years ago, I started noticing that, like, okay, there are a lot of plastic surgeons in Beverly Hills, and how do you differentiate yourself aside from just being a great surgeon? And I was speaking with my website guy, and he mentioned to me something called gynecomastia, which is basically man boobs or male breast excess, right? Yeah. And he had a client in New York that was doing a lot of these surgeries. And I started looking around LA and Beverly Hills, and really was not being done that often. And so I started to concentrate on that and started to do more of those surgeries. Initially that first year where I was focused on it, maybe did another 20 surgeries in that year. Last year I did about 200. And so over the last 10 years, really starting to carve out a niche. And I think that, for me, that's worked really well. To be jack of all trades, master of none was not the best way for me to go forward. So to answer your question, my practice, although I still do a lot of different plastic surgeries, I'm known for male breast reduction and transgender body and chest surgery. And so those patients seek me out because I really have more experience than anyone in Los Angeles for those procedures.
Got it. Now, when it comes to those procedures, kind of talked about this was kind of something new that you didn't really hear about. Then when you started doing it, you started to make this your niche. Now, are there any other new or emerging treatments that you're seeing that you're particularly excited about?
I think so within the confines of my niche, and also you can kind of spread it to other forms of plastic surgery. I think the next kind of frontier for us as surgeons is going to be, how do we solve the problem of skin tightening without all the extra scars. That's really, I think, in the next 5 years going to be the major leap forward to get something that sometimes would take really big scars, whether you're talking somebody with loose belly skin or marginal loose belly skin would have to get a big tummy tuck scar, to then limit that to doing some lipo and then using a non-invasive or minimally invasive skin tightening procedure. There's some things out there now like Renuvion, which is a helium gas. There's radio frequency modalities. I don't think they're exactly where they need to be to really help a lot of patients, maybe the right patient, but I think in the next 5 years, we're really going to see better technology from that standpoint. That'll help my gynecomastia patients who have maybe had some weight fluctuations and they've got man boobs, but they also have loose skin. That'll help them in the future avoid larger scars. And so I think that's going to be the next frontier, is minimally invasive or non-invasive skin tightening procedures.
Got it. Now, for those who don't really understand the difference, how would you describe it as far as what makes a cosmetic surgeon different from like your non-invasive, like think of like your medical spa treatments? So what would you say is like the biggest differentiator between those two?
So I'll take it one step even further. What's the difference between a plastic surgeon or a board certified plastic surgeon versus a cosmetic surgeon versus a med spa treatment, right? So to be a plastic surgeon and to be a board certified plastic surgeon, you have to go through a requisite amount of years of training. Not only that, you have to then take a two-step board certification process, which is one is a written examination, one is actually a 3-day oral examination where you're being examined face-to-face by board certified plastic surgeons from around the country. And then every 10 years, you have to take another exam to maintain your certification. So that's a board certified plastic surgeon. A cosmetic surgeon can be somebody who just takes a weekend course and gets a certificate or pays some money to get certified by the American Society of Cosmetic Surgeons, which is not really a recognized medical board. So it's definitely a different level of rigorousness of training, expertise, and experience. So I always tell patients, because I get this question a lot, especially on social media, like, what do I look for in a surgeon? Definitely look for a board certified plastic surgeon, not just a cosmetic surgeon or, American Society of Cosmetic Surgery. It has to be the American Society of Plastic Surgeons. Now, when you're talking about the med spa side, those treatments tend to involve a lot more non-invasive things, right? So for instance, one of the things that I do a lot of is liposuction. As a surgeon, they're small incisions, but it's still invasive. There are non-invasive modalities too that can potentially remove fat, something called cool sculpting, which you may be familiar with, that frees the fat. There's another version that heats the fat, all in attempts to melt the fat and get it out of your body without going inside and removing it. So these are paddles that you put on the body and either heat it up or freeze it down to shatter the fat cells, and then the body gets rid of them over time. And so these are also technologies that are being perfected, and those are treatments you get more from a med spa or some dermatologist's office, or even some plastic surgeons have those machines. But med spas tend to be more injectables and non-invasive things, where if you're coming to see someone like me, you're coming because you have a surgical problem and you want that fixed surgically.
Got it. Now you kind of touched on this before, but do you offer like some of the medical spa treatments more as a like supplement to the plastic surgery? So like they come in for the plastic surgery and then you have the med spa treatments as that supplement.
So I have all of that in my office as well, and it's for exactly what you said. So some patients come for surgery and then they're like, oh, you do Botox, you do filler, you do this and that. I'm like, yeah, I do all of it. I'm a board certified plastic surgeon. So they'll stay. And because they're happy with their surgical results, the trust is already there, right? The relationship's already there. And then I also have patients who are never planning on having surgery with me, and they just come in for, the Botox, the filler, the laser treatments, and it never converts to surgery, and that's fine too. And so I think the ability to offer the entire spectrum of treatments is what sets a practice apart from just a pure med spa who can only do the non-invasive aesthetic cosmetic procedures.
Got it. Now, I want to ask you about what are some common misconceptions that you get from your patients about the treatments you provide, more specifically if you can break it down into the plastic surgery side, but also on the gynecomastia side, because I'm sure like this is your niche, so I'm sure you have a lot of misconceptions about that in particular. So could you share some of those common misconceptions?
Yeah, so let me start off with gynecomastia. Number one thing is the guys who have it is just because they're lazy, or they're not doing the right workouts, or they're not eating the right foods. And it's something that, like I still, despite all the information I put out there on social media about what gynecomastia is, it's still kind of a myth that, oh, they just need to get in the right training program or hit the gym more. The problem with gynecomastia, it's not a fat problem. It's a breast tissue problem. Like, it's too much gland. And the thing with gland is that you can't shrink it with diet and exercise. You got to actually like remove it surgically. The fat in the chest, you can shrink. So if someone just was overweight and just had a lot of fat in their chest, yeah, for sure. I would not recommend surgery for them. Just get on a healthy lifestyle with diet and exercise, and that'll go down. But if you got too much breast tissue, it doesn't go down. Even if you lose 50 pounds, like, you'll actually probably notice it more. The other thing is that a lot of guys come to me and they say, yeah, I hit the gym like crazy, just doing a lot of chest stuff. The reason why that doesn't work is this breast tissue sits on top of your chest, right? On top of the muscle itself. So the bigger the muscle gets, the more it just pushes it forward. And so they get really discouraged and really, really upset. I'll tell you a non-gynecomastia kind of myth has to do with liposuction. I hear this all the time, and they say, well, if I have liposuction in my belly and I gain weight, will it just, the fat go somewhere else in my body and I'll get fat in that place? I'm like, no, that's not how it works at all. And the reason why is because as an adult, you only have a certain number of fat cells. You don't grow new fat cells as an adult. They're not like your skin cells that keep replicating throughout life. So when you lipo somewhere, you're reducing the number of fat cells. So say like I lipoed your belly, but not your love handles, right? Mm-hmm. So now you've got less fat cells in your belly than your love handles. If you gain 30 pounds, they both increase in size, right? But you're gonna notice your love handles more because you got more fat cells in there. And that's why people were like, oh, I got lipo on my belly and I gained 20 pounds. Now it moved to my love handles. No, your belly grew too. You just didn't notice it as much because you've had that area's fat cells reduced. So the bottom line is liposuction is not a cure-all, right? You still have to maintain a reasonable lifestyle to maintain the results long-term.
Got it. Okay. Now, that's fantastic to share, because I think a lot of people just don't even realize that. Now, when it comes to how you approach educating your patients about what you do, the treatments that you provide, I'm sure a lot of it ties into kind of what you talked about right now, is like trying to dispel a lot of the myths or the misconceptions that they have. But do you have like a specific approach that you like to follow as you educate your patients about what you can do for them?
Yeah, I'm fortunate in that a lot of my surgical patients, like the gynecomastia patient, the transgender patients, they're already so well educated. When they've been thinking about having this surgery for years, it's not something they just thought about like a few months ago. It's probably been burdening them for half their life, if not longer. So they're already pretty well versed in what the problem is. Where I do a lot of education, interestingly enough, is in the non-surgical patients, the ones who are coming in who say have never really done Botox or filler, but they're scared because they're afraid that they don't want to look frozen, or they don't want to look like they're overfilled or puffy. And so it's a lot of education to say, listen, this is not, just all or none. Like, it could be graded, and in the right hands, like, I'm not going to let you look strange because you're a reflection of my work when you go out there. And so it's a lot of education on how these products work, where you should use it in the face, and how much you should use it, and to go little by little to kind of build on it, so you can, not just jump into the deep end, but kind of go in from the shallow end and learn how to swim a little bit in the world of aesthetics for these patients. So
got it. Now, I want to talk a little bit more about the transgender chest and body masculinization that you do. Was this something that you got into kind of as a part of the gynecomastia, or is something that was kind of like completely separate of how you got into it?
Yeah, that's a very insightful question. It actually is exactly the first thing that you mentioned. It kind of organically came from all the gynecomastia surgeries that I did, because in all honesty, they're exactly the same surgeries, just a different patient population. So, gynecomastia can come in all severities, from like just a little bit of tissue under the nipples to full on breasts, right? And so trans patients can have very little breast or full-on breasts. And so the surgeries that I developed and the techniques I developed in all those years of gynecomastia surgery just literally translated to that patient population. So they can see examples, like I had hundreds of examples that they could look at. And even though those patients who had the surgery were not transitioning, they were men who were staying men, the surgeries were the same, and they could see like the impact that it makes on their chest. And that's how I grew the transgender part of the practice. And then once the word gets out, and the transgender community is very tight, and so once your name gets out there and you do good work and you create a safe space for these patients, then they refer other transgender patients. And then the one thing with like female to male, right? So chest masculinization, a lot of these patients, they also have very feminine silhouettes in their belly and love handle, right? They flare out because they have wider hips. Sometimes they carry extra fat and they want a more masculine silhouette. And so it's not just a matter of just doing the chest and then having the rest of it look feminine. It all has to be cohesive. And so that's what I started to do more of too in the last, say, 5 years, is not just the chest, but also liposuctioning the love handles, the flanks, to get it a more up and down straight masculine silhouette. And so, but to your point, the transgender patients, they fully came organically from my gynecomastia experience.
Got it. Okay. Now, when it comes to, I want to understand a little bit of how you balance providing a relaxing experience for your patients, but also making sure that their safety and well-being are taken into account. So how do you make that balance?
I think it starts with me as a surgeon. Like, my philosophy has always been, I tell patients this, like, I will advise you as a patient like how I would advise a family member. And I think if you just stick to that kind of mantra, you can't go wrong by the patient. Meaning, like, I'll never do a surgery on a patient if I don't think it's the best thing for them, because why would I recommend that to a family member, right? So I think they get that sense. I think there's some things you can learn in medical school and some things you can't. And I think one of the things that I've been told by patients is that I just have a really good bedside manner, or a really easygoing, like, straightforwardness. And I don't think that's something you learn. It's just your personality in it, but it's whether people can see that, and I get the feedback that they do. And so whether I'm trying to do it intentionally or not, they feel safe. But the other thing is, the staff that I've hired, they mirror my personality as well. So it's the same ethos that runs through the office from top down and back up. And so that's really important. You can't have the front office respond differently to patients than the coordinator, to the office manager, to the surgeon. It all has to be cohesive. And so I think patients are very sophisticated nowadays, right? And they have options, and there's a lot of social media, and it's all global, and they can get a sense of whether an office is going to be there for them, not just leading up to the surgery, but after the surgery as well. And I tell patients, like, the surgery is not the end of the relationship. The surgery day is just the beginning of the relationship. I got to get you through that whole surgical process. And my office staff is the same way. Every patient has my coordinator's phone and access 24/7 to us. So any issues that come up, they don't have to feel like they're just caught in the cold and have to wait till the weekday starts, weekends, weeknights. And that's really important. And I think it starts top down.
Got it. And I think it's very telling also, because just the kind of patients that you work with, I mean, and I'm just guessing this, but I'm assuming that males that need help with the gynecomastia or the transgender, they're probably more sensitive to this because they face a lot of discrimination or ridicule. And so they're in particular very sensitive to finding someone who really makes them feel comfortable, that they can really trust. So,
right, absolutely, spot on.
Yeah. Now, one thing I want to kind of understand, as far as when it comes to the gynecomastia, like the male patients versus the transgender ones, you said that they kind of come in for the same procedure, but do you find that the challenges that they're facing is similar, or do you find that they're a little bit different?
I think the challenges are definitely different. The life experience for sure is different. Like, I can't tell you how, unfortunately, like how many transgender patients I've come across who have been kind of disowned by their family, or not have no social support, or and I think that's part of it. That's probably the biggest difference, I think, between the two groups. Usually, my gynecomastia patients, it's usually the opposite. Their significant others are like, you don't need this surgery, I love you for who you are, or they're completely supportive. But I've had plenty of transgender patients who have no support. They've been kicked out of their homes and they're just doing this on their own like everything else. I think there are different criteria as well that I have to consider before operating on a transgender patient compared to a gynecomastia patient. What I mean by that is, for a transgender patient, I have to make sure that they've met certain criterion, like they're not just, this is not reversible for the most part, and so that they're actually transitioned in other ways too, not just this is a surgical transition, but that they've transitioned socially, they've transitioned maybe medically, not absolutely necessary, they don't have to be on testosterone, but that they've had to have seen a therapist or under or a psychiatrist at some point, because these are important, as far as like making sure that the surgical transition that we're going to do, they're doing it with full consent and they know how irreversible it really is, and they're doing it for the right reason, right? So those are the nuances that differ between the transgender patients and the guys with gynecomastia.
Got it. Okay. Now, for this next question I have for you, I'm very interested to hear your answer, especially with your fine arts background. But what role do you think creativity plays in how you approach the treatments that you provide to your patients?
I think for me, the one thing that my fine arts background kind of gifted me with was the ability to verbalize what I see when I look at someone and analyze them. And what I mean by that is, like, if someone's not trained, they can look at something and see that something might be off, but they can't really put words to why it seems off. Whereas I can look at it and say, okay, this is off because of, this is maybe like 20% larger, this nipple height is a little bit lower, this shadow is here because the ribs are curved a little bit more than this side, the other side creating a shadow. And then once those things are important because that's how you analyze the patient to come up with a surgical plan, right? The other thing is, though, also knowing the anatomy, which I had the benefit of learning anatomy both in medical school and residency, but also in my sculpture classes, right? And learning how to sculpt the human form in 3D and then taking that experience, and when you're doing this on patients in the operating room, to make sure like it's all cohesive in a 360 degree, so you're not just making their front look good, but it doesn't match their side or their back and it just looks like a Mr. Potato Head, right? Everything has to be cohesive. So I think from that standpoint, I gained a lot of experience from my fine arts background that's kind of trickled over the years to my surgical practice today.
Got it. Now, I'm sure throughout your experience, you've had some particularly challenging cases that have come in. So could you share maybe just one or two stories about a really tough case that came in, but you were able to get them a successful outcome out of it?
Yeah, I have I have challenging cases and I have like emotionally impacting cases, right? And so challenging, not technically maybe, but emotionally, and the impact that it had. So as far as a challenging case, I remember there was a patient that had, it was a transgender patient actually, who had 2 surgeries somewhere else and was completely, I hate the word botched, but it was botched. They had the wrong procedure done at the first point, and then went back, the surgeon went back to revise it and made it worse. And what happened was it was completely just cratered in and looked like a Shar-Pei's skin, right? Like nipples were caved in, the nipples were off, and the skin was just loose in a lot of different areas, and too much was taken out from one area and not enough from another. And so it took a lot, it was almost like a reconstructive case. So that was a case where I had to basically undo everything and then build it back up. And so I ended up using a combination of internal flaps, taking fat from other places and grafting the fat, removing the nipple and areolas and using them as grafts in the proper location. And the patient ended up to do fantastic. Was so grateful. The thing that was shocking to me was that the patient initially had their surgery done in 1990s, and they lived for 35 years or about 32 years that way because they didn't think it was ever going to be fixable. And they came from out of state as well. And so when we Skyped, we visually did the consult, and then when we met in person, we did the surgery. the day of the reveal, the patient just started crying. It's like, I can't believe my chest looks like this. And I also can't believe, like, I've waited this long. And I said, look, in fairness, I wasn't in practice 30 years ago. So like, I couldn't have been there to help you anyway, but I'm glad that, we got you the chest now. And so that was a very difficult case because of all the different, I had to use basically every trick in my bag to be able to reconstruct that chest. I think there's another case that comes to mind from the emotionally impacting one, and this was it was a gynecomastia case in a teenager. He was like 15 or 16 years old, and his gynecomastia was so severe that he was being bullied at school to the extent that the parents took him out of school and started homeschooling him. And operating on teenagers is a little bit tricky because a lot of times kids going through puberty do get gynecomastia. Like 40% of the boys get some breast tissue growth, and most of them it goes away. And so you want to make sure you're not operating on somebody unnecessarily. But in this kid, he'd had it for 3-4 years, was not getting better. And when I saw him, it was very impressive how much tissue he had. And I was like, yeah, no wonder he was getting teased, unfortunately. So I decided to do the surgery. He was like 15, did the surgery, saw him back over the next 6 months. And then at the 6-month point, I mean, he looked fantastic even at 1 month, but at 6 months, he was already re-enrolled back into the school and he was thriving and he was back on a skateboard. And it was like, for me, like, that's why you go into medicine and why you go into surgery. I love surgery because it gives you immediate gratification. You can immediately impact somebody's life for the better, which is why, like, I never went into, say, internal medicine. I couldn't see myself treating somebody's blood pressure for 30 years, but this for me was emotional gratification. I was able to help this kid, help his parents, through a difficult time raising a teenager and get him thriving again. And he didn't have to wait till he was 18. So
that's fantastic. And that's kind of the thing I see when I talk to a lot of practitioners. It's like the reason they enjoy doing this is because of how much of an impact they can make in people's lives.
Right.
So, and that's fantastic. So now, Dr. Dadvand, where do you think that the future of plastic surgery, of aesthetics is going, particularly in your space, the gynecomastia space?
I think with gynecomastia, the only thing that I can see advancing more, like I mentioned before, is the ability to tighten skin non-surgically or non-invasively, right? I think overall with plastic surgery, I think as far as fillers go, we're going to come out with fillers that are going to be even longer lasting, more natural appearing. I think the same thing with breast implants. It's all been a trend towards longer lasting, more cohesive, more natural, less side effects, less complications. I think even with Botox, there's a new Botox that came out, or botulinum toxin that came out called Daxxify. That's supposed to be longer lasting. Everything is about longer lasting. And then I think as far as like aesthetics in general, I think there's going to be this kind of interesting merge of like wellness and health and regenerative medicine with aesthetics, meaning like people want to look better and look younger, but they also want to look more natural too. And it's going to be, well, hopefully long gone, like the overly done things, right? Huge breasts, huge fillers, huge lips. And I think we're going to go into more kind of like natural aesthetics, but also like regenerative, right? Like vitamin injections and PRP and more topical things that can rejuvenate without needing to resort right to surgery.
Got it. Okay, now I have one last question for you, but before I ask it, I want to point people to your website at www.drdadvandplasticsurgery.com and www.losangelesgynecomastia.org. Now, the last question is, what would you say is the most important piece of advice you can give to someone who's maybe a little bit apprehensive or maybe a little bit on the fence as far as getting some type of procedure done for gynecomastia and something's holding them back? What would be the most important piece of advice you can give to someone like that?
I actually say this to my kids, and I also say this to patients too. I say, either do something about it or stop thinking about it. And what I mean by that is, if you think that you can live with it and not be bothered by it, then don't do anything about it. But if you think that you're going to keep coming back to this and it's going to keep weighing on you emotionally and physically, then do something about it, because there's so many more important things you can use your life's energy on. And if you feel like you're using a lot of your life energy focusing on your chest and how it's bringing you down, then take care of it and then get on with your life. And surgery's scary. I've had a couple surgeries on my back, so I've been on the other side as well. And I tell patients, listen, surgery's supposed to be scary, but just do your due diligence, find someone who's experienced in whatever procedure it is, whether it's gynecomastia or rhinoplasty or facelift or even Botox, and find someone who's experienced, they're board certified, you've seen their pictures online, you meet with them, you've got to have a good rapport too. It's almost that sixth sense, like this feeling that you get from a surgeon and the office as well. And I always tell people, listen, go to 3 consults, right? And don't go to more because it gets confusing. But if you go to 3, either they'll all 3 agree that you need the same thing, or 2 will agree and 1 will be the outlier, but it'll be unusual to get 3 totally different answers. And so I think experience matters. I think board certification matters. And I think the overall feeling you get from the surgeon in the office really matter. And then at the end of the day, you just have to decide, is this something I'm gonna do or not? But if you're not going to do it, then just stop thinking about it and move on to other challenging things in your life.
Perfect. Well, there you have it. Dr. Dadvand sharing his expertise. Now, where can people contact you and your practice?
So my practice is 8500 Wilshire Boulevard, Suite 615. Easiest way, obviously, is by phone, which is 310-278-4200. You mentioned the websites. I have a microsite for the gynecomastia just alone. That's losangelesgynecomastia.org. The main website is drdadvand, plasticsurgery.com. But I'm also, on social media like everybody these days, so on Instagram, I think it's DadvandMD. I'm on TikTok and on YouTube. And that's on YouTube. I post intraoperative surgery videos as well of patients who consent for it. And it's a real educational tool more than anything else.
Got it. Well, great. Thanks for being on the show and sharing your message.
Yeah, it's an absolute pleasure, Daniel. Great talking to you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.